Scientists worldwide are currently trying to come up with the possible interventions to an outbreak of avian flu. They all agree that there is a number of unknowns in terms of response to such an outbreak. They also agree that living in today's world means that an outbreak in one part of the world could easily spread to others in a matter of hours, given the proximity and other factors that connect us. The National Institute of Health, through its Institute of General Medical Services, is undertaking a new research program called Models of Infectious Disease Agent Study, MIDAS. The network of scientists and researchers are developing computer models to better understand the spread of infectious diseases such as avian flu. With growing concern that the H5N1 strain of the avian flu, initially found in birds in Asia and some parts of Africa, the research network is modeling pandemic flu responses in different parts of the world. Dr. Jeremy Berg is the director of the NIMGS at the National Institute of Health. He underscores the importance of the interconnectedness of the world we live in.
That's been one of the efforts that the Midas Group has been working on. We are a very connected world with airplane travel and, certainly in countries like the United States, people traveling all over the place. With an agent like flu, which spreads relatively rapidly, one of the challenges is by the time you detect it, or public health officials detect it, it's likely to have spread substantially.
And he adds that the whole idea of modeling is dependent on public health officials in Asian and African countries buying into it.
The utility of these models depends very strongly on the health officials buying into the whole idea of modeling, being comfortable with what they can and can't do, and having a good sense of what they might do with the information once it's developed.
Dr. Berg says that the researchers are also involved in models of other infectious diseases that have been plaguing the African continent for years.
Since, in the case of pandemic flu, the group has been working on doing really a worldwide model, which would include Africa. They're also, the program is not focused entirely on flu, so there are efforts underway, for example, with malaria and dengue, that are, have significant incidence in Africa.
The computer models are used to simulate an outbreak of avian flu and test for possible intervention models to contain it.
So the basic approach is, again, they're virtual people, and the power of these methods is that each individual can...
Like a video game.
Like a video game, exactly.
Okay.
So each person can go to school, go to work, interact with people in their family, with people in their work, people on the street, people on subways, whatever, and you can really try to capture a lot of the heterogeneity, the differences in how different people behave in the model. Then you can introduce into that population an infectious agent like flu, so that some number of people in the population have flu, and they have some probability, if they spend a certain amount of time with somebody else, that they might transmit the flu. And so what the computer simulations do is try to keep track of all this. So keep track of all, in some cases, millions of individuals in the computer, virtual individuals in the computer, let them interact, see what happens, how quickly the virus spreads to the population. The good news is that the avian viruses that seem to be circulating around haven't developed the ability to spread very easily from person to person. We now know biologically some of the steps that might be necessary to take place for that to happen. It's certainly a possibility, but it hasn't happened yet. One of the strengths of this modeling approach is you can test various scenarios without having to wait for it to happen. Obviously, you don't know what the real answer is going to be, but you can do simulations with different levels of infectivity from person to person and seeing how much impact that has on public health.
For Voice of America, I'm Jackson Vonganyi.